There are a lot of misconceptions and myths, especially on social media platforms, about the efficacy of Astra-Zeneca vaccine against the new COVID-19 variants. A study conducted by Visa about the efficacy of Astrazeneca allays fears about the vaccine. According to the study, Astrazeneca is 60% effective against the Indian variant and 66% effective against the English variant. Both the two variants are among the many variants in Uganda.
And this kind of unresearched information which is being spewed to the community only helps to achieve confusion, and it only helps to accelerate spread of the disease because people become undecided.
In both cases, the effectiveness of Astrazeneca was measured 2 weeks after the second shot and against symptomatic disease. The dominant English Kent variant and the feared Indian strain, both in Uganda, have been outpaced with the completion of the 2 doses of Astra-Zeneca immunization test. Against this globally proven test of the vaccine, Dr. Driwale says Astra-Zeneca is effective against the COVID-19 variants.
Then it is going to train itself and practice fighting COVID on a vaccine, so that the chemicals will be produced, the cells which eat the virus will be produced, and cells which will remember that I was once attacked will be produced. And after that, the body is ready. Should the COVID-19 virus enter your body, it will find the soldiers are ready, and it will fight the disease without giving it chance to multiply.
Despite of its efficacy against the new COVID-19 variants, the Oxford Astra-Zeneca vaccine is based on the virus's genetic instructions for building the spike protection. According to Dr. Driwale, the vaccine prevents development of severe disease through controlling the virus from multiplying in the body.
So it prevents severe forms of disease which will require hospitalization, which will require intubation, and which will eventually progress maybe to death. There are people who still, in spite of their vaccination status, have been found positive. There are those who have developed severe forms of disease, and indeed there are those who have died.
In the past, fears had built up in a number of countries over the safety of Astra-Zeneca vaccine after several cases of blood clot or brain hemorrhages in people after receiving the vaccine, with a small number of deaths reported. Dr. Driwale treated these observations about the vaccine as isolated cases, but revealed that glitches were caused by the failure of the body to make good use of the vaccine.
You see, vaccination is the act of giving the vaccine. Getting immunized is your body reacting and building antibodies ready to defend. There are people, when they're vaccinated, their bodies will not make use of the vaccine. And when we say the efficacy is not 100%, it means when you vaccinate 100 people, out of the 100, you may get 10 people who will not make use of the vaccine.
However, Dr. Driwale says the vaccine becomes effective in one's body after 14 days of receiving the injection. So it cannot protect anyone who contacts COVID-19 before 2 weeks.
You get the vaccine today, the body will take 2 weeks to mobilize its immune system, the soldiers that fight disease in the body. It will take about 2 weeks to mobilize. Within that period, although you are vaccinated, you are unprotected. So, if you are infected within that period, the disease will move, and it is your natural body which will be fighting.
At the moment, the first dose only gives 60% protection from the disease, and one requires to get 2 doses to be fully protected. He says it is not a precondition to test before vaccination because it does not make public health sense.
What we know is one dose will give you immune response between 50 and 60, one dose. So if the level of protection is 60, then you are the 40% you are vulnerable. So one dose is protection. You are better than someone who is not being vaccinated at all. Yes, but you are not fully protected.
According to him, many people who have been vaccinated and contracted COVID-19 got mild symptoms, and some who were fully vaccinated succumbed. He explains that Astra-Zeneca is a non-lubricant vaccine that does not cause infection.
Many of the people who have been vaccinated, they are found positive with the COVID, and they have no symptoms, or they have mild symptoms, and they are resting at home, and they are doing well.
Uganda has vaccinated close to 1 million people, with only 60,000 receiving 2 doses. However, these numbers are very small compared to global statistics. I'm Nanfuka Faridah in Kampala.